the Alameda Health System Board of Trustees voted to authorize the EPIC Electronic Health Record Project. This vote says a lot about the board's unwavering commitment to eliminating disparities in both access and quality of care for all residents of Alameda County. The board's decision also demonstrates a high degree of trust and confidence that it places in the providers, the staff, and the leaders of Alameda Health System that we can deliver on this very ambitious project. This EHR will serve as the very foundation on which we would deliver care that is safe, that is timely, that's efficient, and most importantly, that's patient-centered. I would like to thank the Alameda Health System Board of Trustees for their vote of confidence. I would also like to thank the Alameda County Board of Supervisors for their ongoing commitment to the mission of Alameda Health System. Thirdly, I'd like to thank our partners in the healthcare delivery community, chiefly of which I'd like to thank Kaiser Permanente for their investment in health in our community through our electronic health record. And finally, I'd like to thank you, the more than 4,000 men and women of Alameda Health System, for the hard work that you have demonstrated thus far and the contributions you'll make in the future. This integrated EHR will transform the care that we offer in some very significant ways. I'll mention two. First, we will have one universal record for every patient who enters into our care. This may seem significant at first blush, but what it means is that whether you are treating a patient in our clinic, or whether you're treating a patient in our emergency room, or whether you're treating a patient in one of our post-acute facilities, you will now have complete access to the entire record of care for the patient in one system. This will eliminate the likelihood of a harm happening from missing information. It'll also eliminate the likelihood that we will duplicate an unnecessary exam because we didn't know that it was already completed. This will make care a lot more seamless and certainly a lot more effective. Another way in which the record will transform the care that we offer is by empowering our patients to have better and increased access and control over their records. They will be able to, through our patient portal, access key exam results. They'll be able to communicate with their care team. When they need to make an appointment, they can schedule that appointment at a time that's convenient for them. Not only can they do that, but if they need to pre-register for that appointment, they can do that before entering our doors and making their wait time a lot less, and they're able to spend more time with you, the provider, getting the care and the service that they need. Not only will the EHR benefit us, but it'll also benefit the broader community. It will allow us to more seamlessly connect to health centers and other care delivery partners to identify and address gaps in care. This will ultimately contribute to greater health and wellness for all. To pay for this project, we're relying on three main sources of funding. First, we're going to repurpose capital investment dollars, which simply means that we will forego any non-emergent investments in capital. Secondly, we're going to rely on philanthropy. That means that we're going to partner with the Alameda Health System Foundation to solicit donations from institutional and individual donors. Finally, we're going to rely on you to continue the operational efficiencies that you have done over the last 2 years that have resulted in positive operating margin that will allow us to fund this project. Now that the board has approved the project, we should all pause and celebrate this very significant milestone. And now the fun really begins. Over the coming weeks, we'll be hiring staff both internal and external to the organization to comprise a team who will guide us through this project. We'll also be doing things like securing space and other necessary resources for them to be successful. And just a brief teaser for everyone, there will be a branding contest for us to name this project, to name the record that we will be using in the future, and so much more. I think you should be incredibly proud of the accomplishments we've made thus far. I think you should also be very excited about the road ahead. This EHR will serve as the very foundation on which we will provide our care for the future. The next 2 years will be quite an adventure. It's going to be filled with some great times and a few challenging times. As your CEO, I couldn't be more confident that we will rise to the occasion and that we will celebrate a successful EHR implementation. and I am incredibly proud to be on this journey with you.